Hello and welcome once again to Moorgate Andrology. Now in today's video we're going to talk about how to get the best penis enlargement surgery. How to get the best penis enlargement surgery. You know, this procedure has come a long way in recent years, and there are some improvements in techniques that I want to share with you today. Make sure you get the very best from this procedure if you're thinking of having a penis enlargement. Now, the first thing there are a couple of fundamentals that I want to address in the beginning. The first thing is to make sure that your penis enlargement surgery is carried out by a fully qualified, registered urologist. This is really important. A urologist is a specialist in male genital surgery and procedures, and he has the understanding of the male genital anatomy. And they're easy to find. You can find a qualified urologist, and if you're in any doubt, you can always go to the General Medical Council website and check out the qualifications of your urologist. He should be on the General Medical Council Specialist Register for Urology. So the first thing is make sure that your penis enlargement surgery is going to be carried out by a fully qualified medical professional, and that should be a urologist. And the second thing, of course, is where you're going to have this surgery done. Now, this is likely to be in a private hospital that is registered with the Care Quality Commission, or so often called the CQC. This is an organisation that registers and monitors private medical establishments in the UK. So if you have your surgery being performed by a fully qualified urologist in a Care Quality Commission registered private hospital, then you're off to a very good start. Now, the first thing I want to talk about in terms of advancements in penis enlargement surgery is the lengthening aspect, making your penis longer. Now, in recent years, there have been developments in improving the lengthening process. Now, I remember years ago when guys had penis enlargement surgery, after the operation, at about 6 weeks, they were given a post-op traction device. And back then, the idea was to try and keep the penis stretched to prevent the suspensory ligaments from joining up again and pulling the penis back to where it was, which in many cases it did do. But now we use something called silicone buffer, which is an implant that's put in the space that's created when the ligaments are divided. And by using this silicone buffer, we can make sure that the ligaments do not reattach and you keep that extra length that the urologist gave you. So that's really important. If you're going for a lengthening surgery procedure, make sure that you get this silicone buffer to prevent any retraction of the ligament. Now, after 6 weeks, when everything has settled down, you will still get a post-operative traction device to use. Because remember, when we lengthen the penis, we lengthen it in the flaccid state, not the erect state. That comes later by use of a traction device from 6 weeks onwards. And you'll use this device for about 12 months, or even longer if you want, if you're seeing good results. But you'll need to use it for at least a year to see improvements in erect length. So, lengthening surgery, it's lengthening the penis in the flaccid state, using the silicone buffer to make sure we don't get any retraction of the penis after it's been lengthened, and then following on with that post-operative traction device to help increase the erect length. Now, the other big advancement in recent years is in the fat transfer aspect. Now, as you know, the fat transfer is to increase the penis girth, and it's still the gold standard of penis thickening today. We do use temporary fillers, and they are quite popular, but more and more men are choosing a fat transfer. And the reason for that is because a fat transfer will last. and certainly considerably longer than temporary dermal fillers. And also, if you're having your penis lengthened, then it makes sense on a number of fronts to have a fat transfer. Why? Because it costs just a little bit more to get the fat transfer done when you're having the lengthening surgery. And secondly, you will have a procedure that will last compared to temporary dermal fillers. So if you're having the lengthening surgery done, it makes excellent sense to consider a fat transfer for the girth. Anyway, in recent years, there have been very sophisticated purification systems developed to remove unwanted debris from the fat before it's injected into the penis. So once the fat has been liposuctioned out, it's liposuction from your belly or your inner thighs, it's put through this purification system that removes stuff such as blood and oils from the fat before it's injected into the penis. And this improves the survival rate of the fat. It makes it much easier for the urologist to work with. So again, if you're going to have a fat transfer, make sure that you've got this purification system within the procedure. So there you go. I hope that's given you a little bit of an insight into how to get the best penis enlargement surgery. There have been a lot of developments in recent years, and the procedure is now more popular than it ever has been. That's all from me today. I look forward to seeing you back here at Moorgate Andrology very soon. Until then, bye for now.